The debate around COVID vaccines refusing to die, even years after the pandemic, claims keep resurfacing that COVID vaccines may have caused premature deaths, heart attacks, or long-term damage. Now, these have long stood as only allegations. Social media is full of it, all the fear. Families are anxious, but the questions are back and often comes back with one survey or the other. And now a fresh report from Stanford Medicine has entered this conversation. So let's slow this down and understand what this study actually says without panic. Stanford researchers looked at a rare side effect seen after mRNA COVID vaccines, that is myocarditis, an inflammation of the heart muscle. First, the most important fact, these vaccines have been given billions of times worldwide, and all of us have survived. Stanford scientists say that they remain overwhelmingly safe and played a key role in saving lives during the pandemic. But like every medicine, side effects do happen, and in rare cases, especially among younger males, myocarditis was reported after vaccination. What this new Stanford study does is not sound an alarm, but explains why this happens in a small number of people. Researchers have identified a biological mechanism that may trigger inflammation in certain immune systems. And importantly, they say this understanding could help reduce the risk even further in future vaccines. Stanford's cardiovascular experts, including Dr. Joseph Wu, stress very clearly that the benefits of COVID vaccines still far outweigh the risks. The risk of heart complications from COVID infection itself is significantly higher than from the vaccine. So, how should the public really read this study? Not as proof of danger here, but as science doing its job, trying to find out what could be the adverse effects. And it seems like this is one area that has shown concern, but largely the benefits outweigh the side effects. Well, this has happened in rare instances, in rare cases, but it has been observed. It does make the vaccine safe, but one can't not want to know what this study also says at the same time. We're looking at a side effect which has happened in some cases too. So let me bring in our panelists on board to give us a little more. We have Dr. Ashit Sridhar, who's a lead interventional cardiologist, Mangala Heart Hospital. We also have Dr. Samya Nagarajan, allergist and immunologist. Thanks very much, both of you. Dr. Ashit Sridhar, would you want to give us more on myocarditis? What does it really mean? The swelling of the heart muscle. Could that be, a layperson could ask a simple question, is that why so many young people have died post the COVID-19 vaccine? Sudden heart attacks among young people have risen.
Good evening. Thanks for having me here. Basically, what is myocarditis? Myocarditis is an inflammation of the heart's muscle. The heart muscle contains an inner layer of endothelium which becomes inflamed, and the heart kind of dilates, and its ability to pump will be reduced. This is what is called myocarditis, and it's completely different from heart attack. It has nothing to do with the heart attack. Heart attack is basically a condition where the heart's blood circulation is blocked, which will lead to myocardial necrosis or damage to the muscle. Here also in the myocarditis, there is a damage to the muscle, but here the damage to the muscle is secondary to the inflammation of the heart's muscle, which can lead to heart failure. Now, myocarditis more often than not are very mild in nature, where there is generally inflammation of heart, which can only be detected with the blood tests, which is called a troponin, which has been described in the paper which you are talking about, which you usually do it. And along with that, if the patient's vitals, hemodynamic stability is maintained, it's just a mild myocarditis which would settle in time. But however, very rarely the myocarditis can cause significant impact where the heart's pumping function might have reduced significantly, and it can lead to heart failure. And myocarditis can be due to varied reasons. A simple viral infection can lead to myocarditis. A tuberculosis infection can lead to myocarditis. Many of the times, moreover, the most common in viral infections what we come across would cause myocarditis. So these could be due to autoimmune in nature, many times where there could be autoimmunity in the body, where antibodies are produced against our own heart muscle, and which can also lead to myocarditis. It's just basically continuum, or it's a disease entity, or it's a pathological entity, which can be due to multiple agents. It could be due to viral infection, it could be due to drugs, it could be due to autoimmunity. But yes, it has a continuum from a very mild presentation, which is most often which happens, to very, very rarely a critical myocarditis, which can even lead to intractable heart failure and death. So now in terms of COVID,
All right. So you're saying
COVID
it's a
disease
rare
first.
case that could lead to also death. Yeah, yeah.
Yes. So in fact, as simple as an infection like a COVID or any other influenza or even a dengue for that matter, all these things can lead to myocarditis. The COVID infection per se has a much more higher incidence of myocarditis, let's say at least 10 times more myocarditis than a vaccine-induced myocarditis. So most of the times it can be mild, but however, rare cases where, especially in young male or young patients who are less than 30-year-old, especially males, sometimes these myocarditis can be catastrophic. That can lead to intractable heart failures, and if not treated promptly, it can lead to death also.
Right. All right. Let's bring in also Dr. Samya Nagarajan. Dr. Samya, of course, this raises a lot of questions on the risks of vaccination. Would you want to tell us a little more on inflammation around the heart muscle? How does that happen? Apart from, okay, vaccine aside, what is myocarditis? How does one get it with or without the vaccine? Is it a common occurrence?
So, good evening. Thanks for having me here. So, as my colleague Dr. Ashish was highlighting, myocarditis is mainly the inflammation of the cardiac muscles, correct? So, the heart is generally has a rich blood supply and is very sensitive for inflammation. So, and that is why an over enthusiastic immune response does occur in a small number of people. And the heart is a little more prone for inflammation. But the causes are many for having myocarditis. It is not just the vaccine driven, but in fact, the infection driven myocarditis is far outweighs the vaccination related myocarditis. In this study, what you were highlighting, it has been shown that a small number of people, mostly young men, can develop this temporary inflammation of the heart, but it also highlights why it happens after vaccination. To simply put it, I think mRNA vaccines basically teach our immune system to make a harmless piece of a virus so that the immune system can learn to fight against it. In that effort, it reaches out two signals, which is a normal part of the strong, effective immune response. But in a small number of people, this alarm is a little bit too loud. Say for most of the people, if the volume is around 5, a tiny group like the young men under 30, the immune system response could be in the tune of 10. So if the signals are too strong, they can irritate the cardiac cells, causing temporary inflammation, which manifests as myocarditis. And it is not because the vaccine targets the heart or is the heart making viral proteins. It is simply an over enthusiastic immune response. So, all in all, I think myocarditis is very rare, usually mild, and completely reversible. Having said that, I think for us, I think vaccine benefits far outweigh the possible theoretical risk, and we shouldn't be very concerned about the uh, possibility of not vaccinating, because definitely, even with COVID vaccine or any other viral infections, the myocarditis can happen, which is far commoner than associated with vaccine.
Yeah. No, but my simple question here is, how can we explain the number of young deaths that have been reported in the recent past? So many celebrities, that's how we know about it, because many celebrities in their 40s, early 40s, who've died of a sudden cardiac arrest, sudden heart attack, and the numbers have only steadily increased. A lot of them at that point, every time this happens, people say it's the vaccine. Which vaccine you took? It's the COVID-19 vaccine. That's what's happened. A lot of them have had heart issues after that. So it's a little, unsettling. So, Doctor, would you want to comment on that, Ashit? Dr. Ashit?
Yeah. So I had been recently in the epicenter of this debate, where there were a lot of sudden deaths, or at least reported sudden deaths in the city where I practice. Now, as far as sudden deaths are concerned, there are multiple different definitions. There is a sudden death where the patient has died, which is of unexplained cause, which needs to be investigated, and then there is sudden cardiac death, where the death is due to a cardiac effect. Usually cardiac cause. A death is due to a cardiac cause. Usually in young males, the sudden cardiac death actually belongs to a certain category of cardiac diseases, which is called a hypertrophic cardiomyopathy or channelopathies. In the second and third decade, if somebody dies suddenly, especially during exertion or during swimming, or while going for a gym or any of these reasons, it most often it is due to something called a hypertrophic cardiomyopathy or channelopathy. So what is hypertrophic cardiomyopathy? It's basically a genetic disorder where the heart muscle keeps on hypertrophying or increasing in its size, and they have an electrical conduction abnormalities, which will lead to something called a ventricular tachycardia or a ventricular fibrillation, which if untreated immediately can lead to sudden cardiac deaths. After 30-40 years, another common reason for sudden cardiac deaths are heart attacks. So heart attack and sudden cardiac death, they are entirely completely different. And heart attack is also a very significant or a major contributor of sudden cardiac death after 30 or 40 years. So somebody who is in their prime 20s and 30s having a sudden cardiac death is not always due to heart attack. It could be due to different reasons. And none of it would be due to myocarditis. Why? Because myocarditis having a sudden cardiac death where the person is completely asymptomatic and completely leading a normal life is very unlikely. This myocarditis usually presents as somewhere the patient complains of a fever and weakness, tiredness, or difficulty in breathing. Then he presents to a hospital. Generally, he's not somebody who will be moving around normally or getting into his gym and all that. So the myocarditis is very unusual to cause sudden cardiac deaths. The most common reason for sudden cardiac deaths in 20, 30, and 40 is still being hypertrophic cardiomyopathy. Then channelopathies, where there are genetic mutations in the electrical conduction of the heart muscles, which can lead to ventricular tachycardia and fibrillation, which can ultimately cause sudden cardiac deaths. After that, it comes heart attack. Heart attack being the most common sudden cardiac death reason in 40s, 50s, and 60s. Myocarditis doesn't really fall into this category. At least it's not one of the most common reasons for sudden cardiac deaths. And more often than not, patients with myocarditis usually are symptomatic. They would have access to healthcare for one reason or the other reason, or at least there will be people around them will know that they have
underlying heart
and
condition.
It's usually
So
Usually
then are you saying that if you've had underlying heart conditions, if you've had underlying heart conditions, then mRNA vaccines could have triggered it? Could you say that?
Very, very unlikely. No, they're very unlikely, because you can have an underlying heart condition and you don't have to have a myocarditis. Myocarditis is not the reason for the death. The myocarditis is one of the pathology which can ultimately lead to death. They are completely different things. So patient can have an underlying heart condition which can be undetected, and then they can have sudden cardiac deaths because of the underlying condition. And it need not be, it doesn't have to do anything with the myocarditis or a vaccine or an infection. So here what happens is, when you have an infection of the heart, that is called, it will lead to inflammation, and it usually manifests as myocarditis. It's more often than not a viral infection. We do see a lot of viral infections causing myocarditis. Rarely, yes, when you give a vaccine, the vaccine can induce some amount of inflammation. And the paper in question, what we are discussing, I think the idea of the paper or the idea of the investigator was to see how to mitigate the effect of the inflammation. So what they actually have looked into is, I think, something called a genistein protein, which is basically an anti-inflammatory, which is more common in females and in estrogen, high-level individuals, which can act as an anti-inflammatory, and it can reduce the immunity. That is the idea. To that end, whenever the patient is having a lot of viral infections, especially even in COVID, I think a lot of patients were given steroids. Why were they given steroids? It is just to prevent inflammation, not just for the heart, for all the endothelial layers in the body. Many of the times, this infections per se can cause myocarditis. They can cause blood clots due to inflammation of the endothelium and the blood vessels, which will invariably lead to complications. For the mitigation of it or the prevention of it, already there is an existing anti-inflammatory option where the patients has been given steroids. In such a, in the similar lines, this particular paper which in question, they are evaluating an anti-inflammatory effect of genistein in modulating the immune response in patients with mRNA vaccine.
All right. I think you've convinced us that this is the rarest of the rare cases, and that's what even the study says. In rare cases, by and large, the mRNA vaccines have been safe. It saved millions of people across the globe. India also supplied these vaccines abroad that saved lives. So we're still going to live with the fact that the benefits outweigh the side effects. Thanks very much, both doctors and experts on the panel, for that. All right. To all our top stories on Day to Night.